Hi everyone, welcome to week 4. This week what we're really focusing on is actually going to be blood collection. With that being said, I want you to really focus on chapter 4 this week, because that's really going to be the chapter that deals with and talks about blood collection. We'll also be starting to draw blood on our partners this week, so come prepared, ready for class. Make sure you drink a lot of water too. That helps kind of pump up your veins for your classmates. So let's start with what blood collection is. So blood collection, simply put, is phlebotomy, or cutting into a patient's vein. That's the Latin term and what it means for phlebotomy. But before you can really understand and collect blood, you need to understand how your body functions and the structure of your blood vessels work. So blood vessels are part of our cardiac system, and what that means is their makeup is called a closed circuit function. So they take blood from the heart out to the body and then back to the heart, closed, one big circle. Okay. When we talk about what that means, it's dealing with how blood recirculates itself through your body. The thing that you need to know is that all blood vessels have 3 layers to them. They have an outer, a middle, and an inner layer. And those, depending on those blood vessels, where they're at, they have a thickness to them. The only blood vessel that does not have those 3 layers are capillaries, and that's just because they are relatively closer to the skin. So let's start with talking about what types of blood vessels you have. So you have your arteries, your arterioles, you have your veins and your venules, and you have capillaries. And in order to really be able to draw blood, you need to know how those all function together. Okay, so your arteries, let's start there. They're the main function carriers of your blood away from the heart. So their job is to carry blood away from the heart. They do have a pulse, and we've talked about that before, and they're a little bit thicker. But they also branch down into those arterioles. Your arterioles will branch down into capillaries. Capillaries branch down into venules, and venules form together to make veins. Pretty simple. It sounds really complicated, but it's not. And your veins, their main job is to carry blood back to the heart. Okay. Arteries are going to feel more elastic, where veins feel very spongy. I know we've talked about all that before. And I also want to talk about the composition of your blood. So capillary blood is generally going to be ones that have higher hemoglobin and higher glucose, where your venous blood is higher in potassium, calcium, and total protein. So depending on the type of test that you draw, you need to document whether it was a capillary or a venous draw, because that will alter your results of your testing. Alright, now that we've gotten that out of the way, let's talk about the most common veins that we use for blood draw. The most common being your median cubital. That's going to be the vein in the antecubital space, which is that bend in the elbow right here. Okay. Median cubital is the best one because it is the most centered and it's the most anchored. It's going to be the one that's not going to move too much on you. Okay, and that's right down the middle. Your cephalic vein is located on the thumb side. So if you were to draw it up, it would be up in this area. It's less anchored than the median cubital. Still okay to use, but you have to be careful because it is not anchored. It could move or roll on you. And the last one is the basilic, which is on the pinky side. So you can take your pinky and run up, and that's where your cephalic or basilic vein should be. This one isn't used as commonly because it is very poorly anchored, but it also has that basilic vein underneath of it, so if you do not perform it correctly, you could nick an artery, which causes a lot of pain for your patient. So the one that I suggest that you most commonly use when drawing blood is the median cubital, but you want to go for whatever one feels the best and is the biggest and most spongy for you. Alright, so we've talked about how and what and how it works, but in order to really draw blood, you have to have one very important thing, and that's the test requisition. And the test requisition is going to be generated by the provider, and it's going to have It needs to include several pieces of equipment. Now, those requisitions can be either handwritten or they can be computerized. Most places nowadays with EMR are going to have the computerized version, so please be aware of that. But your requisition should include the patient's name, their ID number, or maybe their MRN, which is their medical record number. It needs to have their date of birth, the tests that are to be ordered, who the ordering provider is, the timing of the test. Is it a routine? Is it a stat? Is it going to be timed throughout the day? And some other some other information, like, are they supposed to be fasting? Are they to maybe not be fasting? And fasting really means not of eating within the last 10 to 12 hours. And the last piece is the billing and insurance information. You need to know who you're billing for the test that you're performing. Pretty much makes sense, right? Alright, so now let's really get in and talk about what blood drawing is, what phlebotomy is. There are 3 different procedures that you can use. You can use the evacuated or vacuum tube system. You can use the butterfly method, or you can use a syringe method. Now this week I want to focus on the Vacutainer method. That's the one that we're going to start with. And what that really means is it's using a vacuum tube. So those tubes that you've seen in class, what happens is the air has been taken out of them, creating a vacuum for that tube. It will allow as much blood to come in as air has been taken out. Now, the vials can range in color, and they can also range in size. Most commonly, for adults, you'll see vials that are 2 millimeters to 15 millimeters, and for children, it's going to be either 2, 3, or 4 millimeters. You don't want to take that much blood from a child, and most commonly, you're going to probably use the capillary puncture for children because they don't sit very well to have their blood drawn. Tubes can be glass or plastic, but plastic is really what OSHA would prefer that you use just for safety reasons. They have different colored top tubes, and that's just going to tell you the difference between what additives are in there. So you really need to take a look in your book and make sure that you understand what additives are in what colored tube. When blood is taken and no additive is used with the specimen, the cells will clot automatically, and that liquid part of the blood is called serum. But when the blood is prevented from clotting, and so it's added with an anticoagulant or something to that effect, that liquid portion is called plasma. So make sure that you know the difference between serum and plasma. You really should allow, if you have to let a tube clot, it really should be clotted for 30 to 45 minutes, but really no longer than an hour, because after an hour the sample is no good. And some tubes that you'll see have a layer at the bottom which kind of looks like a gel. When spun down, that actually is the buffy coat, or that middle portion that actually separates the liquid portion from the packed red blood cells. And we'll talk about centrifuging, and actually your discussion this week is dealing with centrifuging, so make sure you watch that video to get a better understanding of it, okay? Both plasma and serum can look very yellow in color and very straw-like, so it's really hard sometimes to know the difference between serum and plasma. In that gel that I was talking about, in certain tubes it's called an SST, or serum separator tube. In others it's called a PST, a plasma separator tube. Okay? Like you guys already know, Vacutainer method, you use a double-pointed needle. So that means that there are needles at each end. The shorter one will puncture the tube, the other side will puncture your patient. And you're going to use a needle holder or a hub, and that's that clear plastic piece that goes between the tube and the needle as to not get blood splashed back at you. The other really important thing when you're dealing with blood draws is knowing the correct order of draw. The reason being is if you do not draw them in the correct order, you can have crossovers of additives, and having that happen gives erroneous or false results for your blood draws. So you always want to start with a yellow top tube or a blood culture bottle. Those need to be drawn first. Then you're going to draw a blue top tube, which is generally used for coagulation studies or anticoagulation studies. Then you want to draw a red top tube, and these are plain red top tubes because there's no additive in them, so they can generally be used as a waste tube. And when I say a waste tube, what I mean is that they can be a tube that you use in between just to make sure there's no crossover of additives. Green is going to come next, and that's going to generally be used for chemistry or heparin studies. Lavender has your EDTA in it, and that's going to be used for most of your hematology testing. And then the last one that you're going to draw is gray, and that's really used for glucose testing. Alright guys, I look forward to seeing all of you on Thursday. I do have all of your handouts printed for you, so come prepared, ready to draw some blood. And don't forget about your discussion post and your 2 responses. I will see you Thursday. Bye-bye.